For many, many people, access to dental care is just not available. And this new clinic that we're opening today is going to make a real difference for a lot of people in this community. It's going to make, for the west side, this is going to be the safety net dental clinic on the west side. And it's a huge gap that's being filled. In an interesting twist of fate, the woman who is going to be running this clinic, Dr. Beverly Cutler, is my dentist. She has a private practice in addition to working for the county, and I've been going to Beverly for more than 20 years. And I've got to tell you, the other office is not quite as nice as this. But she told me I can't get in here, so. But I think it's really wonderful that this is the kind of facility we're providing to people in this community. They really deserve it. And I also think it's really apt and really appropriate that this clinic is being named after a Multnomah County leader who understood that people who, if they have access to health care, are more likely to lead healthy and productive lives. This leader built much of the safety net that we take for granted in this community today. She's someone that a lot of people in this community haven't heard of, but I think a lot of people in this room know, and that's Billy Odegaard. Billy, would you stand so we can... Billy led our public health nurses, and then our health division, and finally the entire health department. And doing that, she improved virtually everything in this county about public health. Billy applied for the first federally funded health clinic to serve families who could not afford a doctor in Multnomah County. Today, Multnomah County operates 8 award-winning primary care clinics where more than 75,000 people are treated every year. Think about that, 75,000 people. Without that visionary, without the network that we built based on that visionary, those 75,000 people would have nowhere to go. At one time, Billy heard about a clinic in a Minnesota high school and thought that that seemed like a really good idea. And from that kernel, we in Multnomah County now have 13 school-based health centers that serve children ages 5 to 18. And for many of these children, if they didn't have access to these clinics in their schools, they would not be getting health care. And Billy saw that dental care is not a cosmetic or an add-on. Instead, it's critical in order for people to eat properly, to live without pain, and to avoid serious illnesses. And her foresight means that today we have 5 dental clinics in Multnomah County, and that Multnomah County is now the largest dental safety net provider in the state. I'd like to honor and acknowledge Central City Concern, because at Multnomah County we could not do what we do without Central City Concern.
I served dinner a few weeks ago at the Blazers Harvest Dinner, and the volunteer medical teams that were there told me that they spent the majority of their time doing dental extractions. And that is the unfortunate reality when people don't have access to dental care. Untreated tooth decay has no good outcome. And that is one of the reasons that Multnomah County has worked with Central City to open this dental clinic. It's a great start, but it's not enough. I have hope that the day will come when anyone who needs it can have access to preventive dental care, and that Mercy Corps and the Blazers don't have to open the Rose Garden for free dental clinics. But until that time, Multnomah County will continue to build our safety net so that people can get relief from their pain and treatment with dignity.
Yeah.